Hi everybody, so I'm Ken Duckworth. Thanks for having me back. So I had 7 very happy years at Vinfen as the medical director, doing all kinds of consultation and support to the staff, doing all this great work to help people live in recovery. I'm going to talk about the John Oliver piece. Okay, so I'll just tell you my little journey. This is a micro relationship story. I was super attached to my father, who spent his life going in and out of psychiatric hospitals with terrible bipolar disorder. He was the first person that taught me that you could be a fabulous person with a very difficult illness. I went into psychiatry basically to help him, and I found a lot of people to help in psychiatry. It turned out there was a lot of need. And then I stumbled upon the National Alliance on Mental Illness. And after volunteering there for a year or two, or a decade perhaps, they asked me to be their national medical director. So this is not a lifestyle choice I would encourage. I have a part-time job in a different city, so this is why I have no hobbies or other actual interests other than mental health recovery, mental health policy. But it is what it is. John Oliver. One of the cool things about being at the National Alliance on Mental Illness is that interesting things come your way. Okay, this is like my dream job, to be a writer for the John Oliver team. I confessed that within 30 seconds of receiving the phone call. The writer, these guys are pretty quick. You can see why I'm doing what I'm doing and they're doing what they're doing. Well, Doctor, clearly you've made a mess of your life. You made a series of terrible choices and you're going to have to live with the shame of that. You know, okay, that's 30 seconds into the conversation. So I confessed that I really wanted to be a writer for Jon Stewart or John Oliver, and they said, okay, great, well, you can help us with the story. And I said, isn't that wonderful? We're going to do a story on mental health parity. And I said, if you do a story on mental health parity, you'll get the worst ratings in the history of the John Oliver story. Why don't you tell the whole story? That hospitals were closed, that we forgot to build a community system, that most people live in jails, that we have no meaningful, coordinated, integrated service system, that people whose first-person experience isn't acknowledged, that we have a chronic shortage of people doing this work, that we have a profound workforce shortage, and a lot of people who are living on the streets basically don't have access to housing or services. And they thought, and they said, okay, we'll think about it. And they said, we're probably going to do that parity thing. And before I hung up, I said, I'm telling you, I advocated for mental health parity for a decade. Now I work at a big insurance company to implement it to the best of my human ability to make as many things possible within the health plan on mental health parity. I'm telling you, I don't think it's going to play that well. So they called me about 4 months later and said, okay, we're thinking about telling the whole story because we've talked to a bunch of other people. So I said, you know, you've made a lot of mistakes in your life. I think you're going to have to work with that, right? I think we all make errors. Same person. So I think it's gotten about 5 million hits, the John Oliver piece. He is quite hilarious. I think that's true. I don't know if they're going to do another one. Because I think if you're going to be part of a social media information attitude sea change, it has to keep coming.